Howdy again, everybody. This is Doc with Thoroughfan, and nobody ever wants to see a horse get injured during the running of a race. And thankfully, through the work of HISA and HIWU, and a lot of the advancements in diagnostics, the increase of pre-race and pre-workout veterinary scrutiny that is required, the change in drug protocols and treatment protocols, withdrawal periods, all of that, even artificial intelligence coming into play, we have seen a dramatic drop in incidents of injuries that occur during the running of a race, and especially catastrophic injuries that unfortunately lead to the euthanasia of the horse over the last 3 to 5 years. And that is just an amazing statistic to see. But we are going to see every now and then a horse that does get pulled up by a jockey that may feel something is off, or a horse that has suffered an injury during a race. So the jockey will pull them up quickly, dismount to prevent any kind of further damage. But what else happens in that case? If you're at the track, you do see it. There's a lot of activity going on around the horse. There's something called the equine ambulance that comes out and picks the horse up. But what is the whole process involved in that? Well, I had a chance to kind of see this all in action recently and put together this little segment for you guys where we're going to follow what happens from the moment a jockey pulls the horse up to the point that they are kind of vanned off in the equine ambulance. And it covers all the steps that are involved in there, all the care that goes into the horse, all the things that are important to ensure that that horse's injury is stabilized and that they are transported either back to their barn for further veterinary care and examination, or directly to a veterinary hospital where they can receive proper care and further diagnostics if needed. So let's all take a look at exactly what goes into taking care of a horse when they're injured during the running of a race. Okay, so right here now, a jockey is pulling this horse up mid-stretch, this filly, and he obviously felt something off with her when she was running in the stretch, so pulled her up as quickly and as safely as possible. And the person in the raincoat there that is now looking at her, this is one of the on-track veterinarians. They are positioned at various points of the track to be able to react at a moment's notice to a situation like this, where they can get to the horse as quickly as possible. Now, you can see that this filly appears to be bearing weight on all four limbs. She never fell down. She didn't go down in any way, so this does not appear to be a major catastrophic injury to her, but they are focusing on the left front leg and seeing what could potentially be going on there. Now, you're going to see them look at it a little bit more and then hold the limb up. And the reason veterinarians and track workers sometimes will do this in the case of an injured horse is they don't want them to potentially do any more damage to the limb than has already occurred. So this way, especially if they've been running, they're amped up, their heart's going, you can see there, the last thing they really want to do is kind of stand still. And if they kind of dance around and stuff like that, they can put some more pressure on that limb and potentially cause some more damage than what's already been done. So you can see now everybody has come in to help this filly. A lot of track workers and some other veterinarians, and they're all going to be working just to keep her calm as can be. And they're also working now to put onto that left front leg what is known as a Kimsey splint. And this is a splint that is designed to kind of stabilize what we call the fetlock area, or the lower joint, the ankle joint, some people call it, on the horse. And now you can see the connections kind of coming in, the groom there, and what is probably the assistant trainer of this filly, or the trainer of the filly, coming in to check to see how she is doing, to try to talk to the jock there to find out what he felt. He'll also be talking to the veterinarians that are there to see exactly what they have found and what their concerns are. And you can see everybody now is just working to try to keep the filly as calm as possible, to keep the leg as stable as possible if there is an injury to it. And, just as assessing other things. They'll be looking at her, checking her heart rate, her respiratory rate, all of those things, making sure that she is as calm and as stable as can be in a situation like this. Again, remember, this filly was pulled up probably during the hardest running part of the race, which is the stretch, so she's going to be fully amped up. And they're just going to want to keep her as calm as possible. The next thing everybody's going to see here in a second or two is you're going to see the equine ambulance come in. And there are easily 1 or 2 equine ambulances at all tracks that are there and stationed to be able to come in and transport an injured or distressed horse off of the racing surface. So you're going to see it come in a second, and they're going to be kind of waving it in there now, as you can see. And they're going to pull it up just in front of her, and then they're going to work to help her walk kind of up onto the ambulance. Now, you're going to see her kind of looking like severely limping and tossing that leg around. That is more just from not liking the splint than anything else. This is similar if anybody's ever put a bandage or seen a bandage put on a dog or a cat, they're going to shake their leg. They're not going to like it. They're going to try to get it off. Sort of the same thing here with this filly. And then they're going to work with her slowly to get her to just walk up onto and into the equine ambulance. Now, the beauty of these equine ambulances is that they actually have a hydraulic mechanism. You can't really see it great because obviously the hedge is there. That brings the deck of the ambulance trailer part right down to the ground, so they don't have to step up onto the ambulance. They just kind of walk onto it. And then you're going to see in a second here, you're actually going to see the whole back part of that ambulance again raise back up and back into position. There you go. And then they are going to go ahead and assess the filly a little bit more once they're in there. They may give her a little bit of sedative, a little bit of a painkiller. They have to be a little careful with that again, because as I said, their heart rate is up. Their adrenaline is pumping. The endorphins are going, the respiratory rate is up, so you have to be careful with the doses of those types of drugs that you give to make sure that we're applying them and administering them safely. And now she's going to go ahead and get a ride. You can see there they're going to take her off of the turf course and take her, in this case, to a local equine hospital where she'll be further evaluated. Sometimes, depending on the issue or what happened, they will be taken back to the test barn, or they will be taken back to their own barn, where they'll be evaluated further, usually by the horse's own veterinarian. So this is what happens when a horse is injured on the track. A lot of times we don't see this part of it, and obviously nobody wants to see a horse get injured, but we at Thoroughfan felt that it was really important to show this, to show the amount of care and the amount of expediency there is with getting to an injured horse on the racing surface and making sure that they can do everything possible to help them out. So if anybody has any questions about this or further inquiries, certainly drop them in the comments and we will try to answer them as quickly as possible. But hopefully this helps explain a little bit what goes on when a horse gets hurt.